Yes, do you have a question or comment?
Is there any way that we could do, exam review on Monday? Maybe, or switch it.
You mean in addition to that, in addition to today?
Or flip it, like
Or
flip
flip it.
Monday.
Yeah.
Like today.
Do Monday today?
Yeah.
As a class, we're kind of
Like,
talking about
do like the
it.
new session today and you would do.
Cause we'll be learning new stuff before we pass.
Yeah,
We should talk
a lot of us, and we have like an anatomy test Monday, so we were kind of hoping to get like a review after the anatomy test before, my therapies.
If y'all would like to do it that way, I can do it that way. It will take me a couple minutes to collect my thoughts to get ready for that. But I think we can do that if that would be preferable. There we go. So that would be unit 3. And I think it's this slide set. So yeah, we can do that. One other minor benefit that will have is that you'll be doing this quiz on Monday, and I will have lectured on the material, I guess. So, yes, we can do that. I like it when people talk about things as a class.
We were talking about it before.
So there's a benefit to me being late today.
Yeah, absolutely.
I don't like to be late. I used to, one grown up and adulting thing that I've learned recently is like, sometimes you need to finish the conversation that you're having and not just be like, well, gotta go, gotta be at this place on time. So sometimes those extra 3 minutes are time well spent, especially when your class knows that you're not usually late and you'll be there, so. And probably Caitlin told you, she's here, I promise. Looking ahead to unit 3. Unit 2, the one that we're technically in right now and about to have an exam on, unit 2 is the most dense, I think, and maybe some things that are less obvious, like how does this relate to human health? Unit 3 is totally related to human health. And we start out talking about, for infectious disease, how do we classify them? So there's a lot of vocabulary in this unit. And what happens when a person gets infected? So what is the pathogen doing? So there are some interactions in infectious disease between the pathogen between the host and a little bit with what is going on in the environment. And whether a person gets infected and how sick they get or not depends on these 3 things in different combinations. So by the pathogen, we're meaning, is it a bacterium? Is it a virus? Is it a fungus? Is it a worm? The host is the person. And the environment is, where are they? What's their diet? What's their general health status? Are they getting medical care? So this one's less obvious what we mean. So, diet, their living conditions, and their health care. That's going to play a role as well. And this is one of my favorite units to teach, I think. So when we are thinking about these factors, The combination of those, will answer the question in different scenarios. Okay. Me and my friend have done all the same things, and we went all the same places, and we both got on the crowded metro car. And she got sick and I did not. We did all the same stuff. We've all been eating the same thing. We've been the same places. She got sick and I did not. Why? And during COVID, you may have felt this too. Like you sometimes assume, well, if one person has COVID in my house, we're all gonna get it. Sometimes, sometimes not. These tell us why. These tell us why. So the pathogen, the host, and then I'm putting environment as a separate thing, and then what's the outcome? Okay, I used to include the rest of this figure down lower. So here are some things that will tend to affect the outcome. So in the host. How old are they? Do they have other health problems? To start with. And then a big one when we're talking about infection is this: do they have prior immunity to this infection? How much sleep did they get the night before? That's a thing. How much stress are they under? That's a thing that affects how likely they are to get infected. So from the microbe or from the pathogen, there are several things that are involved. How dangerous or virulent, that's a vocab word that we're gonna see in a few minutes. What type of pathogen are we talking about? Is this common cold virus, or is this COVID, or is this Ebola? This is inelegant, but how many viruses did the person come in contact with? How many bacteria was in the food that they ate? How did it get on or in the person? Did it get in their mouth? Did they touch it with their hand? Was it on a needle and the nurse accidentally stuck themselves with the needle? That matters. And then we talked about some things from the environment already. So all of those things together are going to determine who gets infected, who does not, who gets really sick, who does not. So if someone gets an infectious disease, they may not even realize that they're infected, but usually they're going to feel something that lets us know they have a health problem right now. They have signs or symptoms of disease. How many of you sometime have had medical terminology? Did this come up? Signs versus symptoms?
I don't know. Medical term, I just remember looking at charts of the body and being like, what is this called? What is this called? What is this township?
Upper right quadrant. Inguinal lymph node. Our oldest son is doing the online class through King right now and kind of learning like actually what's in that class. Like, oh good, glad you're learning that. So there's signs and symptoms, and these are two categories of things that people notice. So a sign of disease, what, does anybody know the difference between these? What's the big difference? Probably not, 'cause you probably didn't read this section yet.
Is it measurable?
Measurable, I like that. Sign is measurable by an observer. Something that you can measure it and probably gonna have a number associated with it, or it's visible. It would be hard to fake. So when patients come in and they sit down on the thing that can be a chair or a bed in the room, the exam room, what is the name of that thing?
Examination people.
Yes, sit down on the thing, and you come in and you'll get training when you're in nursing school to look at them and take certain measurements, and then you write the things down in a chart. So the things that you can measure as a nurse or you can see, those are signs. The symptoms, how you're feeling, yes, you remember this. Those are feelings from patient standpoint. And something that is a symptom is gonna have to be self-reported. And, you know, technically the person could be lying. You don't wanna assume that they're lying. But, if you were a little kid and you came down in the morning and you said, "Mom, I don't feel good. I don't wanna go to school today." Who was that in your house? Yeah. So like, what does your mom do? Depends on what kind of mom she is. Huh?
My mom would tell me to suck it up and go to school.
So, yeah.
My mom was.
You don't feel hot.
Yeah, she would be like, she would know I was probably lying. She would tell
And,
me.
you know, you look at them and sometimes, you know, you could tell they look bad. No fever. No puking. And sometimes I'll say, yeah, you have to go to school today. And the last time I said that to a child, it turned out they had COVID. I felt so bad. And it was, I'll tell you when it was the first week of our school and the first Tuesday of labs. So if I stay home with this child, you all won't come to lab the first day. So I said, no, you gotta go to school today. And then later in the week, Big Brother bought his own test with his own money from his own job, and he had COVID, and I'm like, oh my God. Probably what Joseph had. Yes, he did. I feel terrible. He had only symptoms at that point and no signs. So, what type of things do you, like, you feel it and you feel bad, but you couldn't prove it?
Sore throat, if you don't have like pest pocket.
I'm gonna call that pain.
Oh, yeah. And then,
Yeah, like pain. How can you, I mean, sometimes you can see people are in pain, but they could just be talented acting.
Tired?
Tired. I'm gonna call that fatigue. Would you say blurred vision?
You can sometimes see it if you have cataracts and stuff, but.
Blurred vision. What else?
Breathing problem.
That, you can usually, you can measure how fast and you can hear their breathing. Stuff like nausea. You can tell somebody, I feel so nauseated. One time in middle school band, we would you have your big group and then you go and practice with your instrument specialist, like the brass guy off in the side room. And there was one day I had to do that. And it's like, oh, feel good. He was this pretty old man, and I don't know what he said. And then I threw up on his shoes. Like 5 minutes later. He probably a lot of people say that they don't feel good. Yeah, nausea, and then the other one that's really hard to measure in people is dizziness. My Nana is having so much dizziness the past few years, and it's really hard to help with that, apparently. So what type of, so those would be symptoms, and there's probably others also, but those are the big ones. Oh, here's another big one. Anxiety. That's kind of in between. So what type of things can you measure on people to write down as this is a sign that they have a problem? Temperature. What else?
Blood pressure.
Mm-hmm. We'll call that BP. What else do they measure on you when you go for a doctor visit?
They look at your mouth.
Hungry.
Heart rate, HR.
When they look in your ears.
That would be a visual, I'm calling that visual
Okay.
exam result, yeah. Like that would include pus pockets, is that what you called it?
Yeah.
Nice,
Or like strep throat.
yeah, white patches, red patches. Eardrums swelled up inside your ear. Lots of mucus, we'll put on here also breathing rate and breathing sounds, and then, in more recent years, your oxygen level by that little detector they put on your finger. That wasn't the thing when I was your all's age. Measure your blood oxygen saturation through your finger, which is cool.
I don't know if they would do one, but whenever I was the doctor as a kid, they would also like, we have to be in the
Oh,
cup.
yeah, that's what this is.
Yes. So your blood and urine test results, and what we'll call here scans. Scans, which are not quite the same as a visual looking at you result. Sorry, scans, SCANS. Scans. There's probably more, but that's a good set to go on with. It's not, so this gives information. It's not always usually like, aha, you know what your problem is right away, but it gives information about some clues to what type of infection does somebody have. Okay, so when someone does get an infection, they have an infectious disease, the person will go, from their standpoint, will go through these 5 stages or periods of disease. And make yourself a note. These are based on the person or the patient symptoms. Their point of view. And we are looking at symptoms. So we're going to be looking at the blue curve, which is the symptoms of the person. And for every infection that a person, infectious disease that the person gets, we start the person's timeline based on when were they exposed or in contact with the pathogen. That's when we start this time measurement. So starting from when the pathogen came into contact with them. And from that time until they start to feel something, we call that incubation period. You see, it's flat. There are no signs, there are no symptoms. But the pathogen is on them or in them already. They just don't know it yet. It's incubation period. Feel nothing. They feel nothing. And the length of that can vary depending on the pathogen. So from the moment that the person starts to feel a little bit worse, or people will tend to say things in this second section, we'll make some notes about this, prodromal. Prodromal. Period. This is how people tend to talk about that. I feel a little off. I feel under the weather. What else do you all say when you're feeling that way? Like you're not totally sick, but you think that you're about to.
Foggy.
Foggy.
Not too hot.
Yeah. Not too hot. Oh, people will tend to say, I'm coming down with something. I feel like I'm coming down with something. And in my family, my mom would tend to call this puny. Puny. And some mountain families also will use the word peaky. You ever heard that? He's looking kind of peaky, peaked. Things that they're not super sick, but you're starting to feel something. And what people do when they feel this way, it depends on the person, but some people will go on and seek medical care at this point, and we tend to call them hypochondriacs. But it's actually like this is actually the best time, the most beneficial time to seek treatment, actually. But in American culture, we tend to not do that. For me personally, like, well, if I still feel like this tomorrow, I might do something. Because you might get better. Sometimes you get better. So it's from when you start to feel something to when you start to feel a lot worse. That's prodromal period. So this is going from feel something to feeling way worse. That's what we call period of illness. This one is also called, in some books, the period of invasion. That's kind of more interesting than period of illness, but those mean the same thing. Period of invasion. And during the period of invasion, people's symptoms are going to accelerate or get a lot worse. And this is when the average person is most likely to seek treatment or to start staying home or start resting more. Get in their medicine cabinet. Period of illness or period of invasion. And so that will persist for some amount of time. And then when people stop feeling worse and start to feel better. OpenStax calls this period of decline, but you need to know the other term as well. Convalescent period. Like you're starting to, oh, wait. This book adds in period of decline and then does convalescent period of convalescence. Some books divide this into 4 and they don't differentiate these two. So we're gonna put parentheses around that. Period of convalescence. So the person's symptoms decline. And we would say at this point that the person is recovering. They're recovering. So think about what was an infection that you had that it was like it happened really fast and it was really intense and then you got better really fast. That ever happen? Think of an example.
Brown flu.
Yeah, 24-hour stomach bug. Like you feel fine and then you're just puking a lot and then, okay, it's out. I can move on with my life. Little kids do that sometimes. Like they'll just be playing and laughing and then they throw up. They lay down for an hour, take a nap, get up and they're fine. Technically, that kid went through every stage. Like maybe the prodromal minute for them was the prodromal period was 5 minutes. And then they throw up or they vomit. They lay down and take a nap and the whole thing maybe only took 6 hours. That's a super fast one. What about something that takes forever to get better? Just keeps going on and on. Mono is the good example. Like, and I have not had mono. Does it come on you? How long is prodromal? Does it come on you slowly?
I didn't even know I had it.
You didn't know you had it? Yeah. So if we drew this type of thing for stomach bug, let's call it 24 hours. Stomach bug. Like nothing's a little bit. And then if we drew it for mono. I feel fine, I feel fine, I feel fine. I don't know. I don't know. I don't feel so good. I don't feel so good. It's taking me forever to get better. It's taking me forever to get better. So all infectious diseases go through these stages, but the length of time in the stages change depending on what the disease is. Okay. And we need to write down that statement somewhere. So let's do that right here. So all the stages happen in all infectious diseases. The length of the stages differs with each disease. And this is infectious disease. Okay. Also, this graph is assuming that the disease does not kill the person. We're assuming that they're gonna get better from it. And they go through the period of convalescence. People that got COVID might, we can classify them as people that got COVID and got over it, and then you have people that have long COVID. Long COVID, they would just spend way more time in decline and convalescence, but take forever if they have even gotten back to feeling no symptoms. So one of is actually my drum major from high school. She's now the band director at my high school, and she got COVID, back when everybody was getting COVID. And she could not taste coffee or peanut butter for a year and a half. And like, as someone who's just crazy about coffee, like, oh no. And so she would kind of post about it every so often. And then finally there was this one day and she posted something like, I drank coffee and it tasted like a little bit of something. And they were all commenting like, yay, yes, fingers crossed, let it come back. And then she did get COVID again, but I think her taste and smell has recovered, so.
It took me forever to get my taste and smell back. And like still, like not right now, but like it took like after a year of having it, it was still like I could taste everything, but like less than what it was before.
Less than what it was. I was so worried that would happen to Han. He's like super big foodie and he has incredible taste and smell sensitivity. It's like, I hope if this happens, it happens to me because it won't kill me like it would him to not be able to taste and smell stuff. That's a kind of minor example, but yeah, you hope you get in period of convalescence and get back to no or low symptom quickly, but it depends on the person and it depends on the disease as well. So this, remember, is this a graph this might be a graph that you draw on that exam 3, but you definitely need to remember these are the periods of disease from the person's standpoint. What does the person experience? And with most diseases, that tracks pretty well with how many pathogens are in your body. So see, in this case, the pathogens are multiplying some, and then once they get to a certain point, you start to feel it. And the more of them there are, the worse you feel. This is not accurate for a COVID infection. And you don't have to draw this, but COVID infection, the viruses can multiply quite well in you and build up to a decently high number. So orange is going to be COVID infection, like, oh, you already have quite a lot of virus in you before you feel anything. And there's a bigger gap between how many virus versus how do you feel right now. And because there's a lot of them and you don't feel anything, you can spread it to people much easier. Okay, so in this section on these blank screens, there's supposed to be some vocabulary and definitions about infectious disease. And I have not reviewed this super recently, so I'm gonna skip ahead to a slide that talks about pathogenicity. And virulence. Pathogenicity and virulence. So the first word that we're going to learn for our definitions is an adjective called virulence. Virulent. And virulent is a quality. So if we say that this microbe is highly virulent, we mean that it is harmful to the host. So the more virulent, the more dangerous. So you can think of virulent as being like dangerous. Virulence is the noun version of that. So, for example, we could say that the common cold virus, let's say has low virulence. But we would say that Ebola virus is highly virulent. Much more dangerous. It will cause much more harm in the person. Virulent and contagious are not the same thing. Both of these would be highly contagious. So the word contagious means that it spreads easily between hosts. What else? So something like head lice. Pretty contagious. Actually not virulent. How many of you, I don't know if you even know this, how many of you all, when you were little kids in elementary, did the school make you stay home if you or if the other kid had head lice? Did you have to stay home? Like in my days, like you totally had to stay home. Don't even come back to the school, they would say, until you have 0. And now, no, because we're super worried about kids missing school, especially kids that school is a good environment to them compared to home. So we don't make them stay home because actually head lice is not actually harmful. It's just gross. Gross. My mom was an elementary music teacher and taught every kid in the school. So she would get head lice like pretty often. And every time she got it, she would comb us. You can understand like what a nightmare that is as a child.
They let them stay home now. I mean, let them go to school.
Yeah. Yeah. I mean, it's different. I don't have it right now, I swear. It's just it's different district to district, but yeah, it's much more common now to like, here's some info, take this to your mom or your dad. Ask them to go buy the stuff, but not ban them from school. Not actually virulent, but contagious. The second set of definitions that we're gonna look at are number related. Number related. And the first one is, ID, which stands for infectious dose. Infectious dose. So just those two words, infectious dose. That means how many microbes it takes to establish infection. In a person. Call that infectious dose. LD, let's put this in pink. LD stands for lethal dose, which is a technically separate number. That's how many microbes does it take to kill a person? You can also use lethal dose concept to talk about things like poisons or drugs or, there's a lethal dose for alcohol. There's a lethal dose for water, actually. We talk about that one in AMP2. Have you ever heard the dose makes the poison? Yeah. But in infectious disease is how many microbes. And then when you see on these numbers, something like a 50 down as a subscript. So something like ID 50 is the number of microbes that it takes to make 50% of people infected. So this makes it for a population, not for it like Johnny in the hall. How many microbes does it take to infect Johnny? Well, what if he's just super wimpy or super strong immunity? We look in populations. So what's more useful is to say for, if you have a big group of people, what's the general level of microbes that it would take for half of them to get infected? And we call that ID 50 or lethal dose 50. What is the dose or the number of microbes that would kill half the people? And that makes it more relevant to a big group. What I want us to look at next is infectious doses for viruses and bacteria and protozoans, like in drinking water. How much does it take to infect 50% of people? Because it's hugely different. So norovirus, that's the one that it gets on cruise ships. And it's like a viral food poisoning. And then before you know it, like everybody on the ship is puking or have diarrhea. Super low number of viruses it takes to do that. Rotavirus, there's a new vaccine for this for babies and old people. That's also a really low number that it takes to infect you. But something like, let's say cholera. This is a bacterium that causes cholera. You have to basically drink 1 million to get infected. 1 million. Or with some types of E. coli food poisoning, 10 million. Some types 5,000, some types 100. So it just kind of depends. And normally, if you are ingesting and it's going through your stomach acid's gonna kill a lot of microbes, so there, you have to start out with more because your acid is killing so many of them. Salmonella. This is what's in your chicken, contaminated chicken. It's a lot lower than E. coli, how many it takes to infect you. So how many it takes to infect, it just depends. So this depends on where, how does it enter the person? And how good is it at infecting? We talked about coronavirus variants in here, and as you move from the original, the alpha, beta, delta, omicron, they get lower infectious doses as we proceed through time. So they get more infectious, but they also get less virulent. So let's come back to that concept. Viruses tend to get more infectious. So they would have a lower ID50, but less virulent as they evolve. So infectious and virulent are not the same. They're different qualities. So what we're gonna end on today is get started on what we call stages of pathogenesis. And the stages of pathogenesis, there's 5. And they are stages and they proceed through time, but they're not the same as the periods of infectious disease, because these are from the pathogen standpoint. It's not how the person feels that's having the infection. It is what the microbes are doing. What are they doing? Where are they in each stage? It's from the pathogen side. So for every infectious disease, the pathogen has to start out, the person has to be exposed to it. We have to come in contact with it. And it's not enough just to be exposed to it, but there has to be a match between how the pathogen actually infects and where we contact it. And there's this term, portal of entry. So portal of entry is a place on or in the human body where a microbe could start an infection. Not every microbe can infect you through every part of your body. So for example, if I sit down on a dirty toilet seat and my butt touches it and I don't have an open wound on my butt, and then I later go take a shower and I wash it off, kind of doesn't matter what was on that toilet seat. Unless it can infect me straight through the skin, which not many things can. But, if I breathe in coronavirus into my nose, it actually is able to infect me through the respiratory route. Like, that is where it infects. But if there's coronavirus on this table right here and I just, like sitting here and I was touching it a lot, it's not necessarily going to infect me through the skin. Another example, if for some reason we were to, let me think of another example. There are a lot of diseases that, sexually transmitted diseases that moms can have that do not transmit to the baby through the placenta. There are, certain diseases that can infect you through the eye, but not that many. Do you remember when people were worried about catching COVID through their eyes? The first fall 2020, I taught micro lab. Everybody had to wear goggles. Everybody had to wear masks. And we were all fogging up our goggles, and I was trying to look in students' microscopes. And I thought I was just going to scream. It was so awful. It was so awful. And then, after a while, it's like, actually, people aren't getting infected through your eyes. Not really. So that's the first step. It's not just that you come in contact with the microbe, but it's at the correct place for it to infect you. We will continue with these next Friday. Monday will be review, but don't wait to review for this class totally until Monday. You want to review some ahead of time and use your exam review sheet. Next Wednesday will be our exam.
Thank you.
Mhm. Mhm. See you.